welcome back to Finally Revealed. In this episode, I want to talk about what it's like or what happens when you have a surgery. It's going to depend a little bit about what type of surgery, but these are a few things that are common to most surgeries in the United States. The first thing is you're going to need to have pre-approval from your insurance company. So you'll need to talk with your doctor's office, and they will usually make those arrangements with you. There are certain in-network and out-of-network things that you'll need to know about. Where is the surgery going to be held? How many days hospital stay does the doctor think you need? Is that approved? And those types of things. So the financial part is going to have to be taken care of, usually in advance. There also will be some things to be taken care of afterwards, but while you're looking at this in advance, find out about what your deductibles and what your out-of-pocket costs will be up front, and whether all or part of the actual other expenses are going to have to be paid by you, or are those going to be paid by insurance. So that is one part. The next part is they're going to assign a time and date for you to be there. They should give you instructions. You're typically told not to wear nail polish that has a color on it that hides your fingernails, the color of your fingernails, and not to wear makeup on your face. The reason for that is so doctors and nurses can quickly look and see if you are turning colors, if you're turning blue, or if there is a change to your complexion that might signal a problem that might not be showing up on the various machines. They will have you come in and get prepped and be ready. Women are going to be asked to take a pregnancy test. They may tell you that, they may not tell you that, but they will ask you for a urine sample, and that's the reason for that, is because they want to know before they put you under if you are pregnant, and depending upon the length of the surgery and what's going on, they may cancel it if that is found. They will ask you if you believe that you are pregnant or if you could be. They will dress you in the appropriate gown. They may make a mark on you if you're going to have some type of orthopedic surgery. They may mark it on you. Definitely for cosmetic surgery, they're going to mark you up, and for some other types of surgery. So they may be writing on you while you're awake before you go in. They will have you change into your hospital clothes and instruct you as how to get into the bed that they will wheel you in. They may come by beforehand, the anesthesiologist, which is the doctor or doctor's assistant or physician assistant that comes in and talks to you about the anesthesia they're going to use, and ask you again, which you should have had this from your doctor's office, if you have allergies or any other adverse reactions. They will have told you not to eat before the surgery as well, and those instructions should be followed very carefully. The doctor may or may not come in and speak with you before you go in for surgery. You might ask them in the final appointment before you go to the hospital whether you should expect them to pop in or not. It will depend upon their schedule. When all of this has been done, they will then come in and start administering the drugs that will put you under. There are generally 3 types of drugs as a combination. One will sedate you, one will immobilize you, and one will block the pain. They will take you into the operating room. You will notice it if you are still awake. It is cold in there. It doesn't look like the old-time movies. It sometimes looks like you're in a rec room with cabinets and things. They will wheel you in there. They'll have you count backwards or say the alphabet or some other thing as they're giving you the final drugs to put you out. When you awaken, they will usually bring you may awaken right in the operating room when it's over, hopefully. You may awaken on the way out, and then they will take you to a recovery room. They will move you off of the gurney, the wheeled bed, over onto another one. Sometimes they will let you hop over yourself. Sometimes they will not, depending upon what has been done. And be very careful and don't try to do something you don't think you can do, because people have been dropped before. And you let them take care of it if that's the best way to do it. Once you're then on your stabilized bed, they will bring you warm towels. That's the payoff for being in the colder operating room. The colder operating room is usually for blood pressure to lower and other things, bodily functions to slow down, to enable the surgeon and medical team to do their work most efficiently with least amount of blood loss. Then they will give you the warm towels. If you are nauseous at all as you're coming out of the anesthetic, they may give you a type of medicine to keep you from throwing up. If you feel nauseous, they will keep you there for a time and then move you to your room. Once in your room, you may or may not be attached to different instruments. Maybe you have a saline drip, maybe you have some other type of drug. Pay attention, if you can, to what they are hooking you up to, and ask them about going to the bathroom, if you should save what you do when you go to the bathroom or flush. And also, these things they're hooking up to you, make sure that you understand which ones have to go with you if you go to the restroom, and ask for help if you need to measure out and make sure that you can make it. They will come in during the night and bother you because they're going to take blood pressure and check your temperature, usually through your ear. They're going to be chatty. You're not going to get a lot of rest usually if it's a fairly routine surgery and you're not in ICU and you are conscious. So you'll most likely be tired. They may or may not bring you food. They may or may not let your guests bring you food. Most hospitals these days will let your visitors come about any time, and so you'll want to get that information in advance. When it is time to check you out, they will usually give you various paperwork. You should read it. It will say things like, don't go straight to the mall, don't go out to your friend's house, go straight home. It will give you information on whether you should or when you can shower, information on what you can or can't eat or drink for the immediate future or further out, depending upon the surgery. It will give you information on prescriptions that you may need. Some you can fill at the hospital, some you will need to have taken to a pharmacy. If you have any type of orthopedic, any bone, muscle, arms and legs type of surgery, ask for physical therapy. It's a prescription just like a drug. Ask for that in order to make arrangements to go in for therapy to work that other missing part, and ask if you should start that right away or if you should wait until stitches are removed or your first doctor's appointment, because sometimes they want you to go right away and they don't tell you, and then you're a little bit behind the 8 ball. Sometimes they will send you home with information or exercises or movements or things, and sometimes you will have those practiced in the hospital. There may be certain benefits to talking to the orderlies or nurses in the hospital as far as what you'll be able to do as far as bathing when you get home, and they may have certain sleeves or certain suggestions on how to cover up casts or braces or stitches or things like that that will help you when you get home. As with most things, they are going to act like you know everything, and so they're not going to come in and tell you things. But if you ask, they are more than happy to explain to you, if they have that information. Any papers that you get upon discharge, read those before you leave the hospital so that you can ask any questions that you might have. Some of them may pertain to any medicine patches that you have, or medicine or drugs that you'll be taking, any mobility things, and side effects. Also, if you don't usually take medicines and you're going to have several medicines, ask them about those side effects. Ask them what those might make you feel like, and when that's not good, and when you should call the doctor, if you should stop taking those medicines, or if you should just deal with the pharmacist. Sometimes the side effects of the medicine they'll give you or the drugs they give you, you can't tell whether it's the drugs or whether it's your underlying condition or the results of the surgery. So those are things to look out for while you have the medical team there. Ask them then. It's a lot easier than trying to call your doctor's office later. I hope these tips will help you know what to expect and things to look out for. If you are accompanying someone going in for surgery, you might make a note of some of these things and go with them to ask if they are not that familiar. If this helped you, if you learned something, give me a thumbs up. Share this with someone who you think it might benefit. Subscribe to see our other videos. And thanks for watching. I'll see you next time.